Hi, and welcome to another episode of Hot Takes with me, the Silver Fox. Now, the SNP have had so much problems with the NHS in Scotland, with all the different boards screwing up in one way or another, that they are planning to amalgamate them all into one single authority, one NHS for Scotland, one single board, with one set of directors, and therefore one chief that can be more easily controlled. And we've seen what a marvellous idea that was for the police. Haven't been any issues there at all, have there? And so you're going to have this huge monolithic NHS that will not understand the needs and requirements and the differences between, say, the centre of Glasgow and some tiny little village out in the middle of the Highlands and Islands. It will just be singular, a single board, knowing nothing of the extremities. Decisions will be made based on immediate need for the masses, not immediate need for the regions. It's a very, very bad idea. We don't expect anything other, of course, than bad ideas from the SNP. And you have to worry ultimately about how many people are going to suffer or even die as a result of this incredibly dangerous idea. Let's have a look. So, plans to merge Scottish health boards are being bounced around by SNP ministers. If you've got a single board, it is going to be horrendously bad, but of course then you don't need as many MPs controlling it, SNPs controlling it. Don't need as many politicians getting involved. You can hand most of it down to the board. So let's get rid of a few ministers. Let's see how that works out. Not a chance, eh? Anyway, plans to merge these boards are being bounced around. Scottish Labour is also proposing to cut the number of health boards from 14 to 3. And with Social Care Minister Marie Todd saying that the similar plans are already under discussion at the highest levels. You have to ask why. Why do they think amalgamating all these boards is such a good idea? Other than, of course, control. If you have lots of boards, you have lots of ideas, you have lots of people bouncing things, lots of people in control of their regions, and very few answer to the SNP, if you like, directly. They don't like the idea of other people having control. They want political control over every single aspect. And so ultimately it will be a single monolithic board for the whole of Scotland with political control at the top and effectively, how can we say, treatment gained not by doctors, not by consultants, but treatment by ministers. That's not a recipe for disaster, is it? Anyway, plans to amalgamate Scottish health boards are being seriously considered in a bid to undo the damage wrought by the disastrous stewardship of the SNP. Social Care Minister Marie Todd admitted the proposals are being bounced around within the Scottish Government. And if they're implemented, it would be the biggest shake-up of the NHS since devolution. Under the current system, there are 14 regional boards, ranging from the NHS Greater Glasgow and Clyde, which is appallingly bad. That is probably the worst in terms of what they're actually doing, to NHS Orkney, which has a population of just 22,500, and 8 special health boards for services such as procurement, NHS 24, Scottish Ambulance Service, etc. Scottish Labour has said the incompetent running of Scotland's NHS has resulted in a devastating rise in excess deaths. But a lot of them, of course, will maybe and possibly caused by corporate murder at the hands of potentially Freeman and Sturgeon, police still investigating. Glasgow MSP Paul Sweeney said we've got 14 territorial health boards around Scotland. For a country of 5.5 million, it's way too cluttered. Well, no, not really. The more boards you have, the more local knowledge those boards have, the more and closer connected they are to the regions in which they serve. How does some manager sitting in Glasgow understand the needs and the timeframes of some poor community, some poor sod sitting in a community, up in the top end of Scotland? Hasn't got a clue. He thinks an ambulance is 15 minutes away. It's not. It could be 2 hours away. Anyway, Labour has proposed to rationalise that down to 3. And speaking to clinical professionals on the front line, they're saying systems don't talk to each other. Well, that's a systemic problem. That's not a board problem. Just make them all talk to each other. Have a unifying communication system. It's not hard. There's different procurement systems. Again, standardise it. And there's way too much duplication. I don't know what that means. What is the duplication that you're having? Somebody places an order, somebody else places an order. If you had a single monolithic structure, you're still going to need separate orders because they've all got to go to different places. Speaking to BBC Scotland's radio show, Sunday show, about the shocking levels of bureaucracy within the Scottish NHS, he cited the case of a patient who was unable to leave hospital due to issues with transporting her home in an ambulance. Mr. Sweeney said the patient contracted an infection during her wait and died. Well, that's a shame. It's very sad, but you have to consider how many more people are dying before they even get into hospital. The ones sitting in ambulances for 18 hours. That's why there wasn't an ambulance for this woman. It's not the number of boards. It's people sitting in ambulances for 18 hours waiting to get into hospitals. There's plenty of ambulances. They're just tied up. Scottish Conservative Shadow Health Secretary Dr Sandish Gillane agreed that amalgamation of boards should be looked at and questioned whether they provide value for money. He said most important issue for him was the fact that NHS managers are not regulated, unlike doctors and nurses. Perhaps there should be. Perhaps there should be a professional qualification for medical management. But again, that's a systemic issue, not a board level issue. So there's nothing here for people who make decisions that affect entire boards, millions perhaps of people. They're not accountable for their decision making, and you can see that through the scandals at the Queen Elizabeth. Ad infinitum on those ones. I've done loads of videos on what's going on at the QE, from hiring private detectives to investigate patients, to even ignoring direct health threats during the construction phase where they were told, no, just carry on. Dead birds in the water supply, the wrong sort of ducting for air conditioning, the wrong materials put in, dirt, grime everywhere, fungal infections. They didn't do anything about it. This isn't a board issue. This is a management and systemic issue. There's a difference. I think maybe they are confusing the two. Who knows? He said they're not accountable. So there's no accountability, he said, at board level. The other thing is, if we were to look at amalgamating boards, we need to make sure those who live in rural or island areas aren't overlooked. Bang, bang, which is what I'm saying. This is what I was saying. If you're out there, in some completely far off place, you are not going to enter the thought processes of people in the central belt. Because at the end of the day, they don't care now. Why would they care once they've got this monolithic NHS? It's going to be nothing to them, is it? Miss Todd told the programme that major reforms were already under discussion. They may under discussion, but they're not happening because you haven't got the cash to change anything. But warned that NHS managers in the Highlands and Islands were cautious due to fears that the unique needs of rural areas could be overlooked. Let's change that to will be overlooked. And she added the whole health system has experienced sustained pressure as it has over the past few winters. But actually, she says we're coping well. Well, that's bullshit and a lie. You've got the worst waiting times ever, thanks to the mismanagement of the Moroccan wanker. She says we're managing to maintain a capacity for planned care, but we haven't stopped operations, and there are signs we're coping better than previous pandemic winters. Well, you've never had 18-hour waits in ambulances before, love, so I don't know what figures you're looking at. It isn't the real ones. Anyway, we should round off there and come up. And it wasn't going to be a big one, and it isn't, thankfully. But yeah, I do think, maybe amalgamating one or two, but you can't make it monolithic, and you certainly can't bring it down to 3. There are very big differences between the Central Belt and the Highlands and Islands, and that's got to be controlled. Anyway, I shall finish, round off, and we'll come up. I suggest that the people who live up in the most remote parts of Scotland will be very deeply worried about these plans. We know from just about every other aspect of, sort of political life that anyone outside of the Central Belt doesn't count. If you're any further north than, say, Falkirk, you basically don't exist to these people. If you're up in Durness, Golspie or something like that, you may as well be on Mars. So if anything happens, God help you. You know, they'll probably go, oh, we need to save some money. Well, there's only about 300 people a year use this little facility. Let's close that down. It could be the only facility for 50 miles. That's what they think. That's what they do. And that's what will happen. And people will die. All because of this chronic and terrible mismanagement of everything in Scotland by the SNP, managed by people who just don't know what they're doing. And I mentioned in the piece how about having professional qualification for medical managers. I think we should have a professional qualification for politicians. You can't be a politician unless you pass and have some kind of course. Stop the morons running Scotland or any country. Anyway, I should stop there. Thank you very much for watching. Do please hit that subscribe button, ring the bell, leave a like, leave a comment, please share the video. Until next time, stay safe, stay well, and I will speak to you later. Bye.